Welcome. My name is Peter Strong. I provide online therapy via Skype. So if you're suffering from agoraphobia, then Skype therapy can be a wonderful opportunity for you to get the help that you need to uncover these awful habitual patterns of reactivity that keep you imprisoned in your home or in a very restricted area. So it's very important to find a way of overcoming these habitual anxiety reactions. And I have been developing an approach that's called Mindfulness Therapy that's very effective for agoraphobia and other anxiety disorders. Whatever style of psychotherapy you select, it's important that you find one that's very practical, such as cognitive behavioral therapy or mindfulness therapy, which is my specialty. And whatever approach you use must include some form of exposure therapy that enables you to start pushing those boundaries out, to start overcoming your habitual anxiety reactions. So I've developed a system called mindfulness-based exposure therapy for agoraphobia, which works extremely well and is very easy to learn via Skype. I will teach you how to approach your anxiety using mindfulness techniques that you can practice yourself and start to push back those boundaries. So typically I see people once a week, and then they practice the methods that I teach between sessions, and you should expect to see significant changes and improvements after the first 3 or 4 weeks. Once you start applying the methods that I will teach you, you will rapidly overcome your anxiety and start to break free from the prison of habitual anxiety. So the online therapy option, of course, is very beneficial, if not completely necessary, if you're suffering from agoraphobia, because it's so difficult for you to leave home or travel to see a therapist in their office. It's often impossible. I've worked with people who have really not ventured outside their house for many years, and often just find it impossible to go to a therapist's office or to go to any kind of social setting like a mall or a cinema or anything really that's outside of that very restricted, secure zone that most agoraphobics live in. So it's possible to change all of that if you start applying a very strategic and focused approach like mindfulness-based exposure therapy. Skype is a very good form of online therapy because it allows you to see each other, and that's really important for good psychotherapy. So make sure that whoever you work with offers therapy via Skype. So in the first session, I will start to explain to you how to set up a treatment plan, if you like, to overcome your agoraphobia. The first part of that treatment plan is to set out a series of challenges. This is the exposure part. You must have a set of well-defined challenges that you can work on in a systematic way on a daily basis to start overcoming your habitual anxiety. The approach to each challenge is one of training using mindfulness. This is essential. So I do not recommend exposure therapy by itself. That is not sufficient. It's not going to give you the tools to manage and overcome anxiety. And often people are simply re-traumatized when they just throw themselves into a challenge situation. So we train before we do each challenge. And this involves what we call rehearsal meditation. Mindfulness meditation is really about freeing the mind from those anxiety habits. So the way we do that in mindfulness meditation is to meditate on the challenge itself, to find the anxiety reactions that get triggered, and then to respond to those anxiety reactions in a way that leads to their resolution, so that we can imagine doing that challenge without any anxiety at all. That's essential. That's part of the training. A rehearsal meditation that we would do before the challenge. And then during the challenge, you basically rely on your training to overcome any anxiety that might get triggered. And then after the challenge, you do another kind of meditation we would call a review meditation, which is to play through that challenge that you've just done, to look for any anxiety that may have still arisen, and then you work with that using the methods of mindfulness that I will teach you to help resolve that anxiety, so that you can imagine the challenge that you've just done and not experience that anxiety, that you can feel greater confidence. And then after that, we would repeat the challenge in the same way. And we keep cycling through rehearsal meditation, challenge, review meditation, take a break, and then repeat again until you can do that challenge without any anxiety. Mindfulness therapy is about healing anxiety. It is not about managing anxiety. There are other psychotherapists that take that approach. I do not. I'm not interested in managing anxiety. I'm interested in freeing you from those habitual anxiety-producing habits so that you do not experience anxiety. That's the goal, freedom from anxiety. That's very clear, and that's the purpose of mindfulness meditation, in my opinion, the way that I teach it. It is about developing more and more freedom from habits that cause suffering, habits that take away your freedom to enjoy life to the full. So if you'd like to learn more about Skype therapy for agoraphobia, then do please contact me. Just ask me any questions you have, anything that you want to discuss about this approach. I'm happy to answer questions. When you're ready, though, let's schedule a trial session. I offer a no-risk policy. That is that if you don't like the session, you don't like this approach, it doesn't feel right for you, then there's no charge. There's certainly no upfront charge for my sessions. The sessions are based entirely on your satisfaction with the results. So you pay after each session, but on condition that you are happy with the results of that session. So it's a no-risk approach, and I think that's very important. So if you'd like to schedule a trial session with me and get started on a treatment plan that will help you overcome your anxiety and allow you to develop greater freedom from Agoraphobia, then do please contact me and we can get started. I see people throughout North America, but also in Western Europe as well. I'm from the UK originally. I now live in Colorado, but I see people all over the world, and especially people who want to take a very practical and focused approach to working with their anxiety. In my opinion, mindfulness therapy is one of the most effective approaches there is, followed by CBT. So please contact me if you'd like to get started. Thank you.